CNA transfer from bed to chair. Welcome to the quiz. Question 1. You are beginning your shift and reviewing which patients are assigned to your care. One of your assigned patients has a light on his call bell, indicating that he is requesting assistance. Based on appropriate response to patient requests and promoting patient satisfaction, what is the first step in responding to a patient call light? Option A. Continue with your other tasks and respond to the call light whenever it is convenient, even if it takes a long time. Option B. Answer the call light promptly and assess what the patient needs. Option C. Ask another patient to go check on the patient who is requesting help. Option D. Ignore repeated calls as they may indicate the patient is just seeking attention. The answer is B. Call lights must be answered promptly to ensure patient safety and satisfaction. Option B is correct. Options A and D are neglectful. Option C is inappropriate. Question 2. You are assisting Mr. Edward King, a 66-year-old patient who appears to be experiencing significant pain. His facial expression shows grimacing, his body appears tense, and he is holding his abdomen. He tells you that he is experiencing severe pain in his abdominal area. You understand the importance of addressing patient pain concerns. When observing a patient who appears to be in pain, what is the best action to take? Option A. Assume the patient will manage the pain independently without help. Option B. Give the patient pain medication immediately without involving the nurse. Option C. Ask the patient about his pain, listen to his description, and notify the nurse immediately so that assessment and treatment can be provided. Option D. Assume the patient is exaggerating his pain and that it is not as serious as he claims. The answer is C. Pain must be assessed and reported. Option C is correct. Ask, listen, and notify the nurse. Option A and D dismiss the patient. Option B. CNAs cannot administer medications. Question 3. You are caring for Mrs. Constance Phillips, an 82-year-old female patient who has just been told that her cancer is terminal and that her doctors estimate she has only a few months left to live. She is understandably upset and is grieving about her prognosis. She has asked you to sit with her and listen to her concerns. How should you handle caring for a patient who has received news of a terminal diagnosis and is dealing with end-of-life issues? Option A. Avoid the patient and try not to interact with her, since her condition makes you uncomfortable. Option B. Tell her about other patients with the same condition to help her feel less alone. Option C. Provide empathetic and compassionate care, allow her to express her feelings, listen without judgment, and support her emotional and physical needs. Option D. Change the subject whenever she brings up her condition, trying to redirect her thoughts to more positive topics. The answer is C. Patients at end of life need compassion, presence, and emotional support. Option C is correct. Options A, B, and D are dismissive and inappropriate. Question 4. You are assisting the nurse with catheter insertion for Mr. Walter Mitchell, a 72-year-old male patient. The nurse is explaining the proper placement and positioning of the catheter and how it should be secured. Based on proper technique for urinary catheter placement and management, which statement best describes proper urinary catheter placement? Option A. The catheter can be placed in any location on the patient as long as it is in the body. Option B. The catheter should be secured to the thigh or abdomen using appropriate securing devices, with tubing kept free from kinks and positioned to facilitate gravity drainage. Option C. The catheter should be wrapped very tightly around the leg to prevent any movement. Option D. The catheter tubing should be allowed to hang freely below the collection bag without any securing devices. The answer is B. Catheters must be secured to prevent traction and allow gravity drainage. Option B is correct. Option A is vague and unsafe. Option C. Wrapping tightly can impair circulation. Option D. Unsupported tubing can pull on the catheter. Question 5. You are conducting skin assessments on your assigned patients throughout your shift. You are checking for any changes in skin condition, including redness, breakdown, moisture, or other concerns. You understand the importance of frequent skin assessment in preventing pressure ulcers. Based on appropriate timing and frequency of skin assessment, how frequently should you assess a patient's skin for pressure areas and changes? Option A. Skin should be assessed only once per week during a scheduled comprehensive assessment. Option B. Skin should be checked only once during your shift. Option C. Skin should be assessed every time you provide care, every time you assist with position changes, and at regular intervals throughout your shift. Option D. Skin only needs to be assessed if the patient complains of discomfort or you visibly notice a problem. The answer is C. Frequent skin assessment with each care activity is key to early detection of pressure ulcers. Option C is correct. Options A, B, and D are insufficient. Question 6. You're assisting Mrs. Ruby Edwards, a 76-year-old female patient who has some difficulty swallowing and is dependent on you for assistance with oral hygiene. She has some confusion and is unable to perform oral care for herself. You want to ensure her mouth is clean while preventing aspiration and other complications. Before assisting a patient with oral hygiene care, what important assessment must you perform? Option A. Assume all patients can swallow and tolerate oral hygiene care without any concerns. Option B. Place the patient flat on their back in bed, as this is the easiest position for providing oral care. Option C. Check for any swallowing difficulties, assess the patient's ability to protect their airway, and position them upright or semi-upright to prevent aspiration. Option D. Use whatever oral hygiene products you have available without considering the patient's specific needs. The answer is C. Before oral care, assess swallowing and airway and position upright to prevent aspiration. Option C is correct. Options A, B, and D are unsafe. Great job! Don't forget to subscribe. Bye!